Welcome, patients. Today we have a patient. Her name is Tia. Tia is interested in weight loss through the acupuncture in the ear. So I've been doing acupuncture for 32 years, and I've specialized in doing acupuncture of the ear for weight loss. So today we're going to test our patient so that we can make sure we enhance our program, and we're going to check some areas of the body which sometimes complicate things whenever we do the ear stapling. So Tia, if you'll stand up, we use a system of muscle testing. I'll hold the arm up. I'll ask the patient to please hold that. I gave her a command. She executed the command, so we're all right, ready to go. There are hormones in the brain that have to communicate with all parts of the body, and the main one is this one is called the hypothalamus. This is a reflex point. She's strong. Everything's fine. I come over here to this point. It's called the pituitary gland, and then she just blows out and she's very weak. There's two parts to our pituitary gland. On the opposite side there is one, and she's strong, so we need to support this one. We come down now lower, and the thyroid. You know, if your thyroid is not working correctly, it's going to be very hard for you to lose weight. It means like your idle speed is very low. So we're going to rattle the thyroid, stress it a little bit, and then we're going to test, and she does fine there. But the fuel for the thyroid is iodine, and most doctors do not check this. This is the reflex point. She's strong and she's weak. So I know, even though her thyroid is functioning, through her blood test would probably say normal, she is deficient in the free iodine that she can utilize to power that thyroid. So she'll have difficulty losing weight. Check over the heart, check through the stomach, check over to the liver, check over to the gallbladder area, the small intestine. We drop down to the ovaries, the uterine area. We come over to the adrenal area and the kidneys. Right above the kidneys are an adrenal gland. That's again something to do with your energy source. Some people just don't have any energy. So we've got to correct this so her ear acupuncture will work better. So these are pre-packed. This is 30 days, makes it easy for the patient. In this case, we don't know yet, but we're going to see if it works for Tia. We also have different formulas in this one, and it just makes it easier for the patient so you don't have to buy a bunch of stuff. So we put this here. It's in her energy field. In acupuncture, we study energy. We're going to push down the pressure. I'm going to check. That was already strong before. This one up top on the pituitary area was weak before. It is strong now. I'm putting some heavy pressure on her. I'm going to take this outside her energy field, and she has no energy. Bring it back in, strong, and the body can hold it. Now we're going to drop back down to the thyroid. That was already all right. Their iodine point, still weak. So this does not solve that problem. So now we're going to use a product, a natural product of iodine. I'm going to put it on the patient. It's in her energy field. I'm touching her, so I'm in her energy field, and she's strong. So we've corrected the two things that are going to slow down her acupuncture system to work correctly. So now we're going to put in the acupuncture needles. We always use a clean technique, so have a seat, please. Make sure and use some alcohol and clean the areas. There are 4 areas that we will be stimulating using 2 sterile staples. The patient will become more thirsty with wearing the staples. It is natural for them to become thirsty. We want them to become thirsty. I also tell patients to put a little bit of Himalayan sea salt, just a little finger, put it in your cup when you're going to drink your water. Also a little bit of cayenne pepper helps to stimulate the thyroid. Lemon in the water helps to stimulate your liver. So all those are real important. The first one, we're going to look at her ear, and we're going to stimulate the stomach and the small intestine. And the next one we're going to do for stomach and large intestine. Now, I do not want the patient to leave my office if they're feeling any discomfort. When they walk out of here, they need to feel like there's nothing in their ear. So we have to use a special tool. You don't want anybody to try to take these out of the ear. You need to come back to the office or go to a professional that has the special tools they use to take the staples out. So right now, tell me what you are feeling. Are any of those right now feeling like they should feel like there's nothing in them? Do they feel like there's something in your ears? Okay, which one? Okay, I'm going to loosen it up just a little bit. Okay. Okay. Okay, I'm going to wait 5 minutes because I want to make really sure that she's not having or experiencing any problems. Do you have any questions? I asked the patient to try to keep them in for 3 months. The human blood cell lives to 120 days, so we want to at least give it a fair shake. I want to wear them for 90 days. I have had patients that wear them for 6 months as well. Cleaning or precaution, you don't really want to touch them. You can get a little spray bottle with a little bit of soapy water and just kind of spray around them. You don't need to be real aggressive with them, with drying them or anything like that. Okay, she says it still feels a little weird, so that's okay. That's what I wanted her to do. I'm going to loosen it just a little bit more. Now she's going to start to get thirsty. You get a little bit of dryness around your lip. But look, dryness in the lip, that's a sign that you really need to be drinking more water. So once again, very important. The secret to dilution is dilution. So you have to dilute the body with water, give a transport for the body to eliminate all the toxins. When the body eliminates toxins, then it feels safe to eliminate fat. Fat is held in the toxin. Our toxins are held in our fat. So this is why it's so important to have a safe program. Make sure you're cleansing. So that's why I'm asking you to do a little bit of lemon in the water for the liver. I ask you to do a little bit, get the thyroid working correctly. We're going to be using some nutritional support. In Tia's case, not everybody gets this, but I do check everybody. Now the next thing I'm going to do that sabotages your program is the foods that you eat. There are tons of diets out there. You pick the one that works for you. There's eat right for your blood type. There's eat right for your body type. There's the zone diet. There's all kinds. They actually, they're all will work. You just have to work them and give them a fair shake. Now let's go ahead. But what will sabotage every one of those programs is if Tia is eating some foods that she's sensitive to. We're going to test her the very same way to see if we find some sensitivity to these foods. So stand up for me. Here we have several foods in a little jar. This is wheat, strong, and she's strong. So that does, her body says, whatever energy field is in that wheat, I'm fine with it. Here's beef. She's fine with it. Here's dairy. She's fine with it. Here's corn. She's fine with it. Here's tomatoes. And she drops like a lead ball. So in her case, let's say she loves tomatoes. Well, she's constantly eating tomatoes, it's going to slow down her ability to lose the weight. So the tomatoes are a family of vegetables that, because it showed up for Tia, I want her to stay away from this whole group of foods in the tomato, and they're called nightshade. These are the nightshades. So I'm going to give this to Tia. She can put it on her refrigerator. These are the foods she's to stay away from: white potatoes, tomatoes, eggplants, and certain seasonings. Here's the foods that she can eat. So we're not We're just trying to enhance her program. Okay, what are the ears doing now? Okay, he says this one still feels a little weird, so we're going to continue to loosen it up. I also give a little DVD which can help to explain what all's going on that I produced. Okay, she says it's better, so again, I just want to make sure that the patient is fine. If she has to come back for any reason to adjust them, then that's fine as well. Do you have any questions? Okay, we hope to see you. Thank you very much.